Hi everyone, and welcome to 2019. I am going to talk to you about some absolutely fascinating technology that will change your lives forever. My name is Dr. Elahi, and welcome to Neurospa Brain Rejuvenation Center. Before I go on, I just wanted to give you a framework of how we're going to do this. We're going to actually ask the question, wouldn't it be nice if, and we're going to then talk about who we are, the magnitude of the problem, the new FDA-approved technology, some absolutely fascinating case examples, and some questions and answers. So we're going to ask that question of wouldn't it be nice? Wouldn't it be nice if we use some sort of an advanced imaging technique to diagnose brain disorders like depression or anxiety instead of relying completely on symptoms and subjective accounts? Wouldn't it be nice if we actually treat the problem instead of alleviating just the symptoms? Wouldn't it be nice if, for example, we didn't have to take medications for the issues and instead use real technology to treat the problem? Wouldn't it be nice to boost brain performance and brain power? Wouldn't it be nice to untangle the burden of brain disorders and permit waking up feeling motivated, not feel depressed and anxious, and have a normal mood and attention? Wouldn't it be nice if we could have all that? Well, I'm going to talk to you about how we can. And during this talk, we'll actually discuss some real cases, including a 43-year-old man with bipolar depression, severe manic spells, difficulty concentrating, impulsive outbursts. We have so many people who are unable to enjoy life or even be motivated to do anything or get up in the morning because of this. We'll talk about a 40-year-old mother with depression, anxiety, and memory loss. She's had difficulty with self-guilt and sadness, panic attacks, recurrent headaches, and migraines. We'll talk about a young man with severe OCD, severe anxiety, washing his face in bleach due to fears of contamination. We'll talk about also a 9-year-old diagnosed with autism, a debilitating disorder, highly irritable, explosive anger outbursts, impulsive behavior, poor hand-eye coordination. We'll talk about how we can actually reverse all of these patients' lives without the use of medications. So a little bit about who we are. My name is Dr. Elahi. I'm a board-certified neurologist. I am also an expert reviewer for the State of California Medical Board, a qualified medical examiner. I've had affiliation with Hoag and St. Joseph's Hospital for the last 14 years. I earned my medical degree from the University of Pittsburgh School of Medicine. I finished my neurology residency training at University of Pittsburgh and University of Iowa Hospitals and Clinics. Early on in my career, I studied neuroscience and earned a Bachelor of Science at the University of Pittsburgh. Also early on, I was really interested in the brain, how it works in mental health disorders. I received an award from the NIMH for research in neurobiology of depression. In addition, I've had 14 years of clinical experience treating neurological conditions, extensive experience with EEGs and EMGs. I've published articles, given lectures, and written text chapters on various topics, including strokes, migraines, seizures, and we also work with neuroradiologists, including Dr. Perlis at the RAD Alliance, a wonderful group who helps us with MRI exams, neuropsychologists, neuroscientists, including Dr. Thatcher, who's written our software, and I collaborate with international leaders in TMS applications. So we treat the whole gamut of brain disorders, including depression, ADD, anxiety, chronic pain, concussions. We also boost brain performance and athletic performance. Our mission can be summarized to diagnosis and treating brain disorders effectively, rapidly, safely, and without the use of medications or exposure to radiation. We also aim to enhance academic and athletic performance. The problem is that brain disorders are growing to become a severe pandemic. Currently, the way mental disorders and brain disorders are treated simply involves talking to the patient regarding their symptoms and prescribing medications. So this talk therapy medication approach is not very effective and only works about 30% of the time. There was a large study done in 2006 by the NIMH which showed that these medicines are very ineffective, and if you need to take more than 2 medicines, well, your chances of it being effective are now less than 7%. There's absolutely no objective evidence for diagnosis, and there's heavy reliance of subjective reports. And on top of it, there's poor insurance coverage for these mental health services as well. And the problem is very, very devastating. Every 100 minutes, a teen takes their own life. Suicide is the third leading cause of death among people ages 15 to 24. So this is absolutely unacceptable. So you might ask, how are we different? Well, we use highly advanced technology to make diagnoses. We use also highly advanced technology to treat conditions without the use of medications. So similar to how a stethoscope can actually help diagnosis of many conditions, including heart conditions, lung conditions, we now have an equivalent of a stethoscope for the brain. Wouldn't it be nice if we can listen to the brain and actually hear and see the changes? Well, that's exactly what we do with brain mapping. And here it is. Brain mapping is basically the stethoscope of the brain. It's a very highly advanced technology that can actually map out your brain activity and show us exactly what's going on. For example, a patient with ADD has abnormalities in the frontal lobe, similar to here. A patient with depression has an asymmetric abnormality in a specific frequency here in the frontal lobe, specifically in the left side. Anxiety has high frequency activity here in the front. Migraines often show a very specific pattern of abnormalities. So in this case, we know exactly what's going on. There's no guessing, and it's a 30 to 45 minute recording of brain activity in comparison to a normal database with no radiation, no claustrophobia, and no chemical exposure. And the results can be very, very simple. Here on this brain map, normal is gray, abnormal is red. Can you point to the areas that are abnormal? Absolutely, right here. That's where the red is. That's where the abnormality is. So what does that area of the brain control? This corresponds to this part of the brain, which controls emotional affect and adaptability. This is an example of what depression causes on a brain map, making it very simple to diagnose. So now that we know what the abnormality is, how do we reverse it? Well, we have three advanced tools: transcranial magnetic stimulation, neurofeedback, or as we call it, 3D Loretta neuromodulation, and a device called NeuroTracker. And what's astonishing is that this is very simple. Here on the left side, you have an abnormal brain. This is someone, for example, with attention deficit disorder. And what we do is we stimulate the brain in that particular area with a device called TMS, and suddenly we have a completely normal brain. Again, abnormal, normal. This is someone with depression, has an abnormality in the alpha frequency range in the left prefrontal cortex. Well, we stimulate that with this very convenient device, and those are normalized. So again, abnormal, normal. And the way it works is very simple also. There's a device called TMS. It basically has copper coils through which an electrical current is run. That creates a magnetic field. That magnetic field then in turn causes a smaller electrical current underneath. This is very simple science physics, which is now applied very effectively to stimulate areas of the brain. The patient is watching TV during this whole process with very little, if any, discomfort. And here is our treatment room. This is where people sit, right in here, and this is the coil attached to a computer, and patients are watching television while we actually stimulate their brain. Here's a real example of a patient watching television while getting treated. And this slide demonstrates the difference between drugs and TMS. Drugs go throughout your system in the hopes that they will reach the target location within the brain, within the subset of receptors. TMS, we already know exactly where we're going, and we stimulate or change the electrical activity only in that localized area. And what about side effects? Well, medications can cause all of these side effects. The most common side effect with TMS, if any, is scalp discomfort, which is very minimal. There is also a theoretical risk of 1 in 30,000 seizure risk, which is the same as you would have if you were to take medications. What about the outcomes? It's outstanding. Studies show that for patients who have failed medications, there is a 70% improvement with TMS, and nearly half of the people have complete cure, complete resolution. At our clinic, we've had 99.9% resolution, if not improvement. And the effects are long-lasting. One of the most common questions I get is, after you stop TMS, or if it is completed, Do the symptoms continue to show improvement? And absolutely yes. In other words, while you can get reversal of the symptoms with medicines, the minute you stop them, the symptoms can come back. Not so with TMS. With this type of therapy, the results are long-lasting and they do not recur. And what about neurofeedback? So the idea of neurofeedback is actually very simple. We have technology to actually convert your brain activity into a meaningful image. In other words, you're not seeing just squiggly lines of alpha or beta activity. You're seeing an image like a plane or a car that you can actually understand. And what we program the computer to do is reward normal brain activity and not reward abnormal activity. This entrains the brain to actually increase the normal brain activity and reduce the abnormal activity. And this is done through rewards via audio input or visual input or both. And this has been going on for decades, except the technology is far more advanced and has been absolutely helpful for treating multiple conditions. And this is the actual setup. So patient lies here on the couch, the brain activity is converted to a meaningful image here on the screen, and the brain activity is either rewarded or not rewarded. And here's our office. Patient is sitting down, watching his brain activity on the screen, converted by a device that's sitting on his scalp. And the program is run by the software here. And the results are impeccable. So a patient with ADD, ADHD, has a brain map that looks like this. This is normal, and this is abnormal. And those areas in red are all converted to green within a few sessions of neurofeedback. And the patient, of course, has far more attention span and better cognitive skills. And the usefulness has been recognized by many agencies and academic centers, including the American Academy of Pediatrics, which has been recommending neurofeedback for treatment of ADHD symptoms for decades. And nothing is more telling than real examples. I pointed out some real examples that we were going to discuss, and here's one of them. This is a 33-year-old gentleman with 15 years of severe depression, anxiety, and OCD. And this guy was debilitated. Severe anxiety, recurrent panic attacks. He was washing his face with bleach due to the fears of contamination. He couldn't go outside because of all these irrational fears that were running through his mind. He was unable to sit in a car due to the fears of getting into an accident at any moment. Chronic insomnia. Unable to do even a job interview. Measurement of his severity scale was absolutely significant. His severity scale was 19 on a measure called the Y-box, which is used in clinics and research centers to measure exactly what the severity of someone's obsessions and compulsions are. And anything 7 or above is absolutely abnormal, and his was 19. So what did we do? Well, we first started with the brain map, and this is exactly what it showed. Abnormalities are again shown in red. Cingulate gyrus, which is an area that's heavily involved in patients who have obsessions and compulsions. So we have a clear-cut picture of someone who has severe OCD and exactly where those abnormalities are. Guess what happened to those abnormalities after 40 sessions of TMS and 20 sessions of neurofeedback? Complete resolution. And what happens to his scores after he was done with the treatment? Well, it went down from 19 to 7, completely normalized. And this happened over a span of between 1 to 2 months. And what about his depression? Well, his depression went from a scale of 22 to 3. That's moderate to severe down to minimal, if any. This is what we consider a cure. Anxiety went from a 36, which is severe, down to a 10, which is borderline, if any. PHQ-9 is another measure of depression. Went from 10, which is moderate, down to 3. His Y-box again went from 19 down to 7, all within a span of 2 to 3 months. This is absolutely remarkable and unheard of in the world of neuropsychiatry and neurology. So his irrational fears completely gone, able to drive, not washing his hands or face with bleach anymore, very happy, able to go to movie theaters, drive, have a relationship, and actually have a job. This patient's life was completely reversed within a span of 1 to 3 months here at Neurospa Brain Rejuvenation. This is absolutely remarkable. And here's another example of a 40-year-old mother with depression, anxiety, and memory loss. If you recall, I introduced her case earlier on. She had severe anxiety, dizziness, constant feeling of guilt and sadness, recurrent headaches and migraines. Here's her brain map before. You can clearly see the abnormalities in red. And after several sessions of TMS, almost completely resolved, except for some residual deficits here in top of the brain area called the cingulate and the parietal cortex. So in a span of less than 1 month, this patient's depression went from 16 to 6, anxiety from 34, which is severe, down to 9, which is borderline, if any. His PHQ-9, again, a scale of depression, went from 10 to 4. Not only that, her IQ, which is measured by a computer program that we have called NeuroTrax, went from 93.4, which is slightly below average, to above average at 101.7. This again is absolutely remarkable within a span of 1 month. So in this case, the depression was cured, anxiety resolved, far less dizziness, brain performance far improved, sleeping also far improved. And how about the case of the 43-year-old gentleman with bipolar depression and ADD? This gentleman was also debilitated with recurrent manic spells, easily frustrated at work and home, unable to plan anything, even his thoughts, for over the next several minutes, impulsive outbursts. He was unable to enjoy life or be motivated. He told me that he had to actually struggle to actually get up in the morning and move on. Difficulty with concentration was an ongoing issue. Unable to read a book past a couple pages. Very often sad and angry. And what did his brain map show? Again, red is abnormal, and you can see the abnormalities in the bilateral temporal lobe, especially in the left parahippocampal area. This is an area that controls anxiety and emotional regulation. Guess what happened after nearly a month of treatment? Complete resolution. Again, he started off at October 31st, and within a month in December, this was completely resolved. And what about his scores? Went from a 33 to 6 on depression. Went from a 32 to 15 on anxiety. Went from 20 to 5 on the PHQ-9 depression. And his brain performance improved from 109 to 114. Basically, we cured his depression. We cured his anxiety. We enabled him to have better brain performance, all within a span of 1 month. This is absolutely remarkable, and no other medication or treatment can compete with this. So after the treatment, he was literally a new person. Depression cured, far better attention and brain performance, able to have healthy relationships, more motivation for tasks, the CEO, as he described it, of his brain, far more able. And in fact, his testimonial is available on our website. Here's another example of a 9-year-old boy diagnosed with autism, a debilitating condition, caused highly irritable, explosive anger outbursts, impulsive behavior, very little empathy or perspective, very uptight. For those of you who know of an autism child or who have family members with autism, you can understand and identify with some of these symptoms. Very poor hand-eye coordination. So we used a trial that was done combining TMS and neurofeedback, and in fact the study results were absolutely remarkable. The study showed significant improvement in terms of impulsive behavior, ritualistic behavior, all of the abnormal behaviors once you do TMS and neurofeedback. So what happened with our case? Well, here's the brain map before, showing all the areas of abnormality in red, and then after 18 sessions of TMS and neurofeedback along with our device NeuroTracker, a lot of these areas were completely resolved. So now you have a 9-year-old boy who is much improved, but marked decrease in irritability. Tennis skills completely improved, and now he's able to play competitive tennis. This was absolutely remarkable. So in summary, those few examples of real cases that we've treated showed you some of the accomplishments that we can achieve here at Neurospa. Curing depression, anxiety, reducing chronic pain, improving focus, all of which in turn helps relationships with loved ones, family workers, co-workers, and of course markedly increases productivity at work, school, and athletics. Feel free to find more information online on our website. Call us with any questions. See our Yelp site, Facebook, Instagram, or YouTube. I invite you to find out more information on your own, and please let us know if you have any questions. Thank you for listening.